One of the things I just learned is that jet lag, and I'm not talking about from here to California, but if you go from here to Beijing and you do that, every trip that you take, your jet lag gets worse. What's that about?
Well, jet lag and the sleep problems associated with jet lag are related to our circadian rhythms, and that has to do with our 24-hour wake-sleep cycle. And of course, when we're traveling across time zones, we're simply advancing the time or delaying the time, and that has a disorienting effect on our circadian rhythm system. Some individuals tolerate jet lag and travel across time zones quite easily, and others have quite a bit of difficulty with it. Most individuals tolerate westbound travel much better than they do eastbound travel, okay? Because when you travel west, you're actually just picking up additional hours, and you're not really losing hours per se, whereas eastbound travel is associated with later and later clock times, which can have a bigger impact.
Right, and so you world travelers out there better think about that. If you're noticing that you're not jumping back in from jet lag, you might want to talk to somebody about it. Well, we've talked about medication, but there are several primary sleep disorders that come under the heading of excessive sleepiness. Do you want to touch on some of those?
Well, I'd be happy to. We touched on obstructive sleep apnea, and of course that is a very common problem in our society. It can affect individuals of any age. We tend to think of it as an adult sleep disorder, but we can clearly see obstructive sleep apnea in adolescents and even in children. Interestingly, in children with obstructive sleep apnea, they may not necessarily complain of excessive sleepiness. In fact, they may have more or less an ADD picture, in other words, attentional deficits, distractibility, impulsivity, and sometimes even excessive activity or hyperactivity.
Because they're trying to stimulate themselves to stay awake.
That's exactly right. And so children with obstructive sleep apnea may actually look like they have ADD in the classroom, and teachers will often comment about that. So obstructive sleep apnea would be one of the more common causes that we see in the sleep center for excessive sleepiness. The other disorder which we have touched on, and I think is a very important disorder to talk about, is narcolepsy. Narcolepsy is a neurologically based sleep disorder that causes excessive daytime sleepiness regardless of the amount of sleep the individual obtains at night. And it is a neurological disorder. It's not caused by laziness or apathy or medication effects or anything like that.
And as a neurologist, you understand this fully.
Well, it is a neurological problem caused by a biochemical defect in a particular region of the brain called the hypothalamus. Right. And there is a deficiency of a biochemical that's called hypocretin. And we don't fully understand exactly how the individual becomes deficient. We know that it sometimes will run in families, but often just appears in a random fashion without necessarily a family history. And the key thing with narcolepsy is to identify that it is there.
And it's so different from the other sleep disorders.
It is. Most individuals with narcolepsy have moderate to severe sleepiness. In other words, it's not just some minor, mild sleepiness that's there some days and not others. It's typically present every day on a chronic basis, regardless of how much sleep the individual obtained.
We would say that it's disabling without treatment.
Generally so.
Generally
That's
so.
right.
Before we go totally into narcolepsy, I did want to bring up restless legs and the only reason why I think it's a great subject is because there are so many commercials from the pharmaceutical companies talking about restless legs. So what is that?
Restless Leg Syndrome has been around forever, but it certainly received a lot more attention in the press lately, primarily because we do now have medications that can effectively treat restless legs. Restless Leg Syndrome is a phenomenon that actually occurs during wakefulness, but it affects one's ability to fall asleep and stay asleep. It's a very disagreeable, some would say a creepy, crawly sensation in the legs. Can occasionally involve the arms, but it's maximally expressed in the legs. And The individual often has a need to get up and walk or stretch or move about.
They think that will help them.
It does provide some temporary relief, but as soon as the individual sits down or lies down, the symptoms come right back, and it's very disagreeable. Most people report that it is almost an intolerable feeling, and they must move or stretch or have their legs massaged.
Well, it's basically impossible to get a good night's sleep, because even if your mind is trying to go to sleep, your legs are moving and that sensation is constantly there the whole time, so you're constantly being aroused. And the other funny thing about this restless leg thing is that it can start early in the afternoon. Like you'll be sitting watching your afternoon soap opera, and all of a sudden this creepy, and it is a creepy crawly sensation. That's the most common thing that I've heard from people. And they can, I know someone who can't sit through a matinee movie because it starts there, and then she goes, well, I've just got to get up. Well, I mean, you're in a movie.
That's right.
But that's really treatable.
It is treatable, and it may be treatable just through some lifestyle changes. For example, caffeine makes restless leg syndromes worse. And so, tapering and discontinuing caffeine use may provide some significant improvement. It often occurs with individuals with iron deficiency and anemia. And so treatment with iron may improve restless leg syndrome. If those measures are not successful, we do have prescription medications that may help as well.
Yes, they've been very successful with that, actually. Okay, what about sleep? I'm going to call it what we call it at the Sleep Center, sleep maintenance, which means staying asleep at night once you've fallen asleep. And then some people can't get to sleep. Those are things that cause excessive sleepiness during the day. What are some of the reasons behind that?
Well, what you're describing is insomnia.
Okay.
And so insomnia means that the individual has difficulty falling asleep, difficulty staying asleep, or the individual does not feel well rested upon awakening the next day. And obviously there can be a connection between not obtaining enough sleep at night and then feeling drowsy the next day. In individuals with insomnia, that would again warrant a discussion with the patient's physician, and in some cases a referral to a sleep center for a more comprehensive evaluation. There are many, many causes of insomnia.
Yeah, that's a huge subject. But I just do want to say that stress and worry that's some of the psychological things, but those are things that can be handled. I don't know if what your sleep medicine specialist is going to say about that, but it is a reason why people cannot stay asleep and can't get to sleep. And also a spouse with a sleep disorder.
Absolutely.
Oh, heavens, if you've been sleeping with someone who can't sleep, you can't sleep either. So bring that one in and then come with them.
Well, the ripple effect is immense. There can be impact far beyond the patient themselves.
Right. And